The following portion of Loving Living Local is sponsored by Alice's Clubhouse. Welcome back to Loving Living Local. We're here today at Alice's Clubhouse, a memory care day center with David and Lisa. Thank you both for joining me.
Thank you for having us.
Yes. Now, David, you started Alice's Clubhouse because of your mother.
Yes, my mother was diagnosed with Alzheimer's about 10 or 12 years ago, and my father, who was aging at the time, was her primary caregiver. And what we discovered during that time was that there was a gap in the healthcare system, that there wasn't a place for someone who wanted to stay at home or their loved ones wanted them to stay at home and be able to be cared for, because someone with a memory issue really does need attention, does need stimulation, does need a focus on what they're doing to allow them to remain as healthy as possible for as long as possible. And my father was adamant that my mother wasn't going to go to a 24/7 care facility, and he was going to care for her. And along the way, we met someone who had run a similar facility in Connecticut, and there are a few in the country, not many. We're the only one in South Carolina. We're certainly the only one in the Lowcountry. And we decided we needed to build Alice's Clubhouse. So we opened about 5 years ago, and my mother came every single day. And the joke was she was going to be the only person on the planet who wasn't going to want to come every day, and she loved it. She actually even gave us a hard time for not being open on weekends. And it changed their lives. And saying their lives is really important, because not only does it positively impact the person who has the dementia or other memory issue, but it is as valuable for the caregivers as it is for the person with the diagnosis. That my father, who was a very intense person, really bore down on his caregiving to his detriment. And when we opened Alice's Clubhouse, all of a sudden he became lighter. His sense of humor came back, and he became healthier. He was able to do what he needed to do to tend for himself, and knowing that my mother was being cared for well.
Although we're not a cure, there's no cure for this type of disease, we can provide programs and activities that will help prolong the inevitable process of this. A lot of our activities that we have are specific for things such as balance and coordination. We do exercise to help with that. We do a lot of cognitively stimulating activities that make them use their brain as far as word finding and colors, and there's just a lot of thought that goes into the program and reasons behind why we do what we do. So we are set up as a medical model, and what that means is we have registered nurses on staff. I'm a registered nurse by background. We have another registered nurse on staff, and we have a licensed rec therapist, and we run our program so that we can meet the medical needs of our members as much as possible. So we can provide medications if they need that, injections. We are set up with a exam room where they can be seen by a physician here if the need arises. We have care plans and charts made up for our members, just like you would see in a doctor's office or something like that. We get their medical history, we know what medications they're on, so it just helps us be able to provide a more safe and inclusive environment for them while they're here.
You can feel it when you walk in, how bright and happy it is.
Absolutely, and the physical environment that you're talking about is incredibly intentional. The colors were picked because we know they work well for someone who has a memory issue. There are hidden messages in the colors of what doors people can go through, what doors they shouldn't go through. And the idea for the whole environment should be a positive place. The amount of laughter you hear here, the amount of friendship that you can feel is incredible. The effect of the program is extraordinary. One of my favorite stories is that we had a member who had Lewy body disease, which is a horrible, horrible thing to have. And he had been suffering for a while. He had been staying home, not getting the stimulation he needed. After being here for like just 2 or 3 days, I came in one morning and his wife was standing there crying. See, it does it to me every time. I'll try to get through it without crying. And she was crying. And I asked her what was wrong. She said, let me tell you a story, that he ran a major company and I was in the marketing department of that company. And we never saw each other during the day, but we would always get together at the end of the day, and we would have a date, and he would ask me out on a date. It's been years since he asked me out on a date, and last night he asked me out on a date.
Very special.
It is special.
Yeah.
The preceding portion of Loving Living Local was sponsored by Alice's Clubhouse.